Hello, my name is Professor Branko Kolarić. I'm head of Referral Center of Ministry of Health of the Republic of Croatia for health protection of elderly. My today's topic is commitment to global strategy and action plan on aging and health. So what is healthy aging? Healthy aging is about functional ability, about developing and maintaining functional ability, not about chronological age. And functional ability is a capacity of individual to perform the activities and tasks that can be normally expected. During the lifespan, we all experience significant losses. Physical or cognitive capacity, we lose family members, we lose our friends. But on the other hand, we experience ongoing psychological growth, and it's a process that spans the entire life course. So aging is a valuable, if often challenging, process. And we want to develop a world in which everyone can live a long and healthy life. This global strategy and action plan was adopted at 69th World Health Assembly in May 2016, and action plan is for the 4-year period. It ends this year. So it's time to see what we have achieved in our commitment to this strategy. There are 5 goals. The first one is about politics, the second one is about age-friendly environment, the third one is about healthcare system, then about long-term care system, and fifth is about health research innovation. So the first one, commitment to action. We should all have established national frameworks for action on healthy aging and strengthen national capacities to formulate evidence-based policy. And the challenge is how to combat ageism and transform understanding of aging and health. That means that we all should change how we think, feel, and act towards age and aging. There is example from Croatia. We have public health gerontology in Croatia. We have 6 formal teams in public health institutes funded by National Health Insurance. Teams are consisting of medical doctors, specialists in public health or epidemiology, and nurse and other professionals. We do data analysis, identifying needs and priorities, and develop public health programs. Here are guidelines for healthy aging, 15 instructions we developed. The second goal is developing age-friendly environments. We should foster older people's autonomy out of institutional care, not to get them in institutions. We should enable older people's engagement and promote multi-sectoral action. So, participation of older persons in decision-making and development processes at all levels. Here is some assistance, home assistance for elderly example from Croatia. We employed female workers that were hardly to be employed, and they help elderly at their homes. The goal number 3 is aligning health systems to the needs of older population. So we should orient the health system around intrinsic capacity and functional ability of person. Not to be about diagnosis, about process, it's about functional ability. We should develop and ensure affordable access to quality older person-centered and integrated clinical care, and ensure sustainable and appropriately trained, deployed, and managed health workforce. We should tackle ageism in healthcare facility. We can hear from healthcare professionals, oh, he or she is too old, it's normal to have that and that condition. It's not normal. That's ageism. And we should also tackle burnout among professionals. It's demanding a job. So we developed and continually provide communication and relaxation training for caregivers and nurses from homes for elderly. This is the photo from one of our trainings. The goal number 4 is developing sustainable and equitable system for long-term care. We should establish and continually improve sustainable and equitable long-term care system build workforce capacity, and support caregivers, and ensure the quality person-centered and integrated long-term care. So families alone cannot meet the needs of older people. They need our help. We should help families in care of their older family members. And the goal number 5 is improving measurement, monitoring, and research on healthy aging. We should agree on ways how to measure, how to analyze, describe, and monitor healthy aging data, how to strengthen research capacities and incentives for innovation, how to research and synthesize evidence on healthy aging. Example of good practice is SHARE. It's a survey of health, aging, and retirement in Europe. It covers 27 European countries and Israel, and it covers about 140,000 individuals aged 50 years or older. European Union has invested more than 100 million euros so far. Data are available to the entire research community free of charge, and please use the data to see the situation in your country and compare with the neighboring countries. What's next? Well, there is a new document developed and there is draft available. It's called Decade of Healthy Aging 2020 to 2030. And please read the document, give some feedback, and we will have it by the end of this year. So, at the end, some take-home messages from this presentation. Please do promote concept of healthy aging, and it's about functional ability, not chronology. Include older people in your society. Support informal caregivers, that means families and friends, and take care of your professionals. Finally, combat ageism, as it's about functional ability, it's not about chronology. And thank you very much for listening and watching this presentation, and I wish all of us very successful conference.